our job is hardcore.
There's all sorts that can happen.
Everything we do relies on this bond between us all.
Just stay down. No.
You're okay, you're okay.
You have to be comfortable in high-stress situations.
Save a life, and you're a hero.
You're in the hospital.
How much? Do you want to tell me what drugs you want and when?
Save 100, you're a nurse. In Australia, 1 in 10 nurses hails from the United Kingdom.
It's a bloody good job. It's so good.
Big deep breath in.
Through their eyes, you'll see life.
Push.
Good girl!
Death.
Unfortunately, we can't save her.
And everything in between.
Coughs, colds and sore holes.
Welcome to the front line
2, 3.
of one of the world's toughest
It's all right, darling. We're looking after you, okay?
and most trusted professions.
It was scary, hey?
Nurses are superheroes, without capes, just in scrubs.
It's a particularly hectic day in one of the busiest hospital departments in Australia.
You're in the emergency department. It's at Vincent's.
Over 50,000 patients come through its doors seeking urgent medical attention.
There is no such thing as a typical day in ED. You see people with headaches, you see people with injuries, you see people that have been in car crashes, intoxicated people, drug-affected people. Anything comes in the door. Head down, bum up, get in and get it done. My name is Carly and I'm a registered nurse in the ED department. When I was younger, I was the paper girl at the local hospital. I was probably about 8 or 9 with the old cart and the whistle.
Oh, look who's here.
Here we are. I looked up to the nurses and I thought, that's something I would like to do. Oh, do you want a hand?
Yeah, sure.
All right, I'll send these bloods. Where would you be without nurses? Up the creek without a paddle.
Carly's shift is just beginning and a patient is already on their way.
It's Carly in ED. Can I have a major trauma resus 2, please? Thank you.
A 28-year-old man has been discovered unconscious for reasons unknown.
GSS 3, which is the lowest score you can get, so it's the most unconscious you can be. He's got an evident head injury, so he doesn't sound good.
If he's not collared, we'll collar him when he gets here. So 28-year-old male, history of going out last night drinking with a friend. They came home around 2 a.m. Friend reports he fell to the floor. All we can find is an abrasion on his left eye. Friend denies any drug use, just says alcohol and doesn't have any other medical history on him.
Where we're located, we have a very big drug and alcohol catchment area.
He does have equal pupils, they're about 4 mils. He's just having a little vomit there.
Just open up for me, mate. That's it.
The worst case scenario is that he could aspirate, so he's going to vomit. He's got no gag reflex. It's going to go straight back into his lungs and give him pneumonia, and essentially he'll die from it.
Jacob, open your eyes. Jacob, open your eyes. You're in hospital, mate. Jacob.
Yeah.
Very strong. Come on, mate. Open your eyes. Open your eyes, buddy. Jacob. Hold on, buddy. Yeah, we'll have to sedate, I think.
Yeah. I've got ketamine. Do you want to ask?
Yeah. Oh, careful, everyone. Can you work security in, please, so we can get an arm, so we can get a second line? He's quite combative.
Hold on, buddy.
Until they sedate him, there's no telling what's wrong with him and how urgently he needs treatment.
Jacob.
The neurology department at St Vincent's Hospital treats an average of 1,500 patients a year.
We're just being super cautious.
The dedicated team performs complex brain surgeries.
You can see the brain pulsating away.
To improve the quality of life for those suffering from a number of debilitating conditions.
Neurosurgery, when it's successful, it can be life-changing. But we're working within millimetres, and one wrong move can be disastrous.
Is this admissions?
Anne is one of over 80,000 Australians living with Parkinson's disease, a neurological movement disorder with symptoms including tremors, rigidity and involuntary movement.
Parkinson's to me is all the things I can't do. It's like even getting dressed is difficult. I can't write. Goodness me, writing's terrible. You know, I don't like to go out walking very far by myself in case I fall over. It sort of makes you feel incompetent.
Today, Anne will undergo a revolutionary surgical procedure called deep brain stimulation. She will be awake during the entire operation.
For deep brain stimulation, the idea is that we insert electrodes into the part of the patient's brain that is not conducting electrical signals correctly, and we stimulate that area. So the goals of deep brain stimulation for Parkinson's is to improve patients' quality of life by alleviating the symptoms that are hampering them doing their normal activities.
Scrub nurse Naomi has over 20 years' experience in the specialised field of neurosurgery and has assisted in hundreds of deep brain stimulation procedures.
Yeah, you feeling okay?
Yeah.
Good, okay. If you need anything, just yell out. It's hard sometimes because you can see the fear on some patients' faces, and we try and make that a bit easier for them.
Whilst Naomi scrubs in, Anne is prepared for surgery, which involves shaving her head, a necessary step to minimise the risk of infection.
Having the hair cut off, it's daunting. It's up there with all the things I'm not happy about, but it's a small price to pay.
The MRI that was done prior to surgery, that looks nice.
Anne has been fitted with a frame that will keep her head perfectly still during the delicate procedure. Principal neurosurgeon Dr. Benjamin Yonker and neurologist Dr. Stephen Tish will map the coordinates in her brain to precisely implant electrodes.
Okay, and let's scroll up from there. Other way.
Yeah, it's still...
I think that's okay. Yeah, still reasonably lateral.
Over the next 4 hours, a team of 5 doctors and 4 nurses will try to literally switch off the effects of Parkinson's.
The surgery is unique in that the patient is awake for the majority of the procedure.
Does your neck feel okay there, Anne?
Yeah, I think so, yeah.
Excellent. Can we get a swipe of prep and the local?
Yep.
Gloves.
And you're going to feel something cold on your head in a moment. Yep.
Dr. Yonker will inject local anaesthetic into Anne's scalp so that she won't feel the incision he needs to make in order to access her brain.
Okay, a little bit of a sting, Anne. I'm just going to put a little bit of extra local into your scalp now.
But the brain itself has no pain receptors, so the implantation of the electrodes will be painless.
A patient's awake for the procedure so that when we put the electrodes in, we can test that they're actually in the right place and that they're actually alleviating the patient's symptoms.
Anne's real-time responses to questions and repetition of physical movements during the procedure will be crucial.
Being awake while someone's drilling into your skull and putting electrodes into your brain is pretty daunting.
How was that, Anne? A bit strange?
I think all of us imagine that the patient could be a family member or a loved one, and we do try and make sure that we treat them as we would want our family members to be treated. If we can make a patient more comfortable in any small way, we'll go out of our way to do that because it's such a strange and scary experience for patients being awake.
And have you got our cables?
Dr. Yonker guides recording microelectrodes into the target positions, which can be up to 7 centimetres deep into Anne's brain.
And that's the sound of your brain you can hear there, and in a couple of minutes we'll hear some different sound as we enter the subthalamic nucleus.
It's the most perilous part of the procedure due to the risk of seizure, brain bleed, or even stroke.
The stakes are high. One wrong move can have catastrophic consequences.
How was that, Anne? A bit strange?
In the surgical theatre of St Vincent's Private Hospital, Parkinson's patient Anne is 90 minutes into a deep brain stimulation surgery, during which she must remain awake.
And that's the sound of your brain you can hear there. And
Once we've made the hole in the skull with the drill, we're able to insert something called a micro driver into the brain, which places the electrodes where we want them to.
If the surgery is successful, the electrodes will override the malfunctioning part of Anne's brain that is causing her Parkinson's symptoms.
So, Anne, I'm just going to take your right hand out just to check a few things.
Anne's neurologist, Dr. Tish, conducts physical tests to establish the baseline of her symptoms, which include rigidity and tremors.
It's a bit restricted, isn't it? Rigidity's a 2, full range, moderate severity, but there is a tiny bit of tremor, grade 1. You okay?
so, Anne, we're going to do some test stimulation now. What we're looking for is to see if it has any effect on that bit of rigidity that you still have, and also to look and see if there are any side effects, okay?
So, 0.5 milliamps.
Very small amounts of electrical current are fed through the electrodes that are in place deep within Anne's brain.
Everything fine? Any pins and needles or numbness? Anything of that sort? Look left, right. Still okay?
So, yeah.
There's no more rigidity, so we'll be mainly looking at side effects now. 2.5, go to 3, smile, big smile. Go to 3.5.
The amount of electrical current is increased gradually. It's a very fine line, as too much current can result in difficulty speaking, numbness, and physical discomfort for Anne.
Sometimes there's complications that can occur.
Go straight to 4.
Oh, it feels weird all over.
And look left, right.
So it's pretty awful, actually.
Hold on, buddy.
In emergency,
Jacob.
Carly and the team have called in security to help manage an intoxicated patient with a suspected head injury who's becoming increasingly agitated.
Jacob.
All that we know is that last night he's been drinking and then he was found on the floor this morning and he's quite combative and agitated and not waking up. It looks like he's got some kind of head injury, so he'll need to get sedated. Yeah, it's 100 of ketamine just gone in.
So, yeah, lots of vomitus around the airway.
With the patient still vomiting 7 hours after his last drink, the decision is made to sedate and intubate him to prevent suffocation and allow the team to examine him safely.
When you guys are ready, I think we'll make a move to tube.
100 a rock?
Yeah.
Okay. Okay. Rock's going in right now. The decision to intubate someone is never taken lightly because it is quite invasive procedure and there are a lot of risks involved. You know, trauma to the mouth, trauma to the throat, trauma to the chest cavity, trauma to the lung. You can cause someone to have a pneumonia just by putting them on a ventilator, so it's always a last resort.
Can someone have a listen to the chest? Secure.
With Jacob fully sedated and safely intubated, he's sent for a CT scan to determine whether the fall he had in the early hours of the morning has resulted in a spinal injury or a bleed on the brain.
Okay, we all ready to go?
Yeah, ready?
Yeah.
He's acting like he does have a head injury. He's at a decreased level of consciousness, he's agitated, he's not waking up, he's doing non-purposeful movements, so all of those are signs of a head injury, hence why we're going to scan his head and just see what's going on. They're also going to scan his neck because he might have injured his neck at the same time as he fell.
Okay, so we'll roll on 3. 1, 2, 3. And down. 1, 2, 3. Yep. Okay, everyone ready?
It might just be a lot of alcohol, but it'd have to be a very lot of alcohol for those symptoms.
In surgery at St Vincent's Private Hospital.
Go to 3.5.
Dr. Tish has been slowly increasing the intensity of electrical current through the electrode implanted deep into Anne's brain.
That last little bit of testing was a bit unpleasant because we were just probing the level for where side effects occur. Okay. Do you feel fine? Can you say the days of the week? Monday, Tuesday?
Monday, Tuesday, Wednesday.
A bit louder so everyone can hear?
Monday, Tuesday, Wednesday, Thursday, Friday.
Good. So, Ben, there's a very good effect at target at 0.5 milliamps. That's very loose. Can you see that? Rigidity's just about disappeared.
It's amazing seeing the instant impact. I mean, you can really see what we're doing, what we're achieving.
See that?
Yeah.
That's better.
Yeah, look at that. That's a definite pop there, isn't it?
Very big. So the tremor seems to have disappeared. So tremor's down to a 0. Does that feel looser, that arm now?
Yeah.
Does feel looser? Feels like you've got more use of it?
Yeah.
It's exciting, isn't it?
Yeah, it is.
So it's a lot looser than before we started the operation. It's great.
It's definitely a source of hope for the patient. They obviously notice the immediate effects of the stimulation while they're in theatres, and it just, I mean, it's not a cure, but it certainly improves their quality of life for hopefully many years.
Both of those brain electrodes are now in and secured. Now we're just going to give everything a good clean and then close it all up.
The electrode stays in place after the operation because that's what actually overrides the electrical signals in the brain that are not firing correctly. And it stays there permanently for the rest of Anne's life. It's always great to see the patient respond so well. It's a really rewarding experience for all of us, the whole team.
After 4 hours of surgery, Anne will now be transferred to the intensive care unit for monitoring.
And we've just brought you up to intensive care, okay? You've done very well.
Although the surgery has been a success, the care she receives in the coming days will be crucial to her recovery. She's not out of the woods yet. In emergency, Carly is anxiously awaiting the results of a CT scan for her patient who fell while intoxicated.
We're all done, guys. We can start taking off.
Thank you.
That's good news for Jacob. His scans are all clear. The best explanation for his deeply unconscious state would be alcohol consumption.
A great outcome is someone will come in with an issue and it's not life-threatening and we can treat them and get them back home again.
1, 2, 3. I think we need some more muscle to roll the shoulder. It's not rolling easily. Okay, we're on 3. 1, 2, 3. Yes, better. 1, 2.
Why were we ever trying to do it with 2 people in the first place? He's 230 pounds.
For women that can.
I do think he'll be okay because, you know, his blood pressure was rising and his limbs are starting to move, so they're all good signs that someone's trying to wake up.
Jacob will be transferred to the intensive care unit for observation overnight.
Whatever is the issue, we greet everyone with open arms. We're here to help.
30-minute drive from St Vincent's is the maternity unit at the Mater Hospital.
Birth Suite, Heidi speaking.
There, a roster of 90 nurses work around the clock in the specialised area of midwifery.
It's when things aren't going to plan, particularly in labour, if there's any complications, baby's heart rate drops, or we're in a bad position, people appreciate you being there in those moments to support them, and it reminds you again, you know, that you are making a difference. My name's Heidi and I'm a new graduate midwife. It's cold and rainy out there, so it's a good day to be inside. I've started at the Mater at the beginning of the year. Morning, Susan. I think it's a great career to be involved in. I guess you're seeing the start of life. Henry, hello. It's beautiful. I would like to have a baby one day, but for now I think I'll stick to my dog. I'll wait a few more years.
I just put the stamps for the vitamin K and then...
As a first-year midwife, Heidi has been taken under the wing of senior midwife Jeanette.
Jeanette's beautiful. She's been my preceptor since I started. She's had so much experience in midwifery in Chile and in Australia. You can tell she loves her job.
Heidi is preparing the birthing suite for a third-time mum who is due to have an induction.
And within the light, we have a PowerPoint inside.
So an induction is bringing on labour artificially.
That means if they want to listen to music.
There's a few reasons why you might have an induction. Sometimes the placentas don't work as efficiently once a baby's overdue. If the woman gets gestational diabetes or any other complications.
It's a big day for Heidi.
Laura, how are you going? We're just down here in room 4, if that's all good.
She'll take charge of Laura's care while Jeanette supervises when needed.
We'll monitor Bub for the first bit and then we'll get the induction started.
Yeah, perfect.
And Bub's been moving around a lot this morning.
Yep. Not heaps this morning.
Not heaps? Okay.
Yeah, not heaps this morning.
Not much room anymore. And are you happy if I have a quick power where he is?
Yeah.
Sorry, my hands are very cold. There's a major emotional role that we play with people, forming those relationships often quite quickly with people. And who's looking after his little brothers today?
Oh, daycare, hence why choosing today. We're just trying to keep them in routine and...
Yeah.
Yeah.
That connection that you make with someone, even in a short period of time, is a special part of this job.
I think our 3.5-year-old gets it. Like, I told him my baby has a present for them.
Oh, that's nice.
And our 2-year-old, whatever.
Laura's labour will be induced by breaking her waters.
So we break the waters, then how long do we wait potentially?
So we'll put the monitor back on Bub for about half an hour or so after we break the waters. And when we break the waters, we'll give your cervix a nice sweep as well, which will also probably irritate it a bit and, hopefully bring on some contractions.
Heidi has watched Jeanette perform the procedure, but she's only done it herself twice before.
Just check baby's trace and baby's heart rate's looking really good. So we're going to go in and do an examination and hopefully break our waters. Just feel some cold jelly.
Yeah.
And hopefully we can break your waters. So just going in now.
Yeah.
Tickling Bubba's little head. So Laura.
But Heidi senses something isn't right. Heidi asks Jeanette for a second opinion.
It's gonna be cold, okay? It's a little bit of pressure there.
Heidi's instincts are right.
What happened at the moment, I don't want to rupture the membrane because what I found, the baby has a little hen here. I can feel the little fingers in there saying hello.
So baby is basically sitting with their hand on our head if the cervix was here. Obviously that's not an ideal presentation.
We will just call your doctor and ask him what he wants to do.
Laura's obstetrician is called in to check on whether the induction can proceed, given the baby's position.
Maybe I'll just do an examination and see if that hand's moved. It looks like it's at least beside the head, and there's fingers in front. Bit of pressure. It can easily get through to the membranes. Yeah, really, it wouldn't be safe to do that right now.
The obstetrician confirms that Heidi's hesitation to break Laura's waters was right.
When there's something, if you like, in front of the head, what the risk is, things like cord prolapse.
The doctor is sending Laura home in the hopes that the baby moves on its own in the coming days.
If you've had a date set and they've been planning to come in and have their bub and have to go home, it would be really difficult.
Take your time, okay? Yeah. It's not unusual. The babies, they can do it all the time.
But at the end of the day, mum's safe and bub's safe. So that's the most important thing for them. Yeah.
See you, bye.
One in 7 Australians is over the age of 70.
He is a lot more pale than normal.
The ageing population's increasing need for healthcare has seen a rise in elderly patients requiring emergency medical attention.
Are you on any blood thinners? Yes.
Every day can be a big challenge in the emergency department. We certainly see a fair share of elderly patients. It can be difficult.
Paramedics have brought in an elderly woman.
Hello? Hello?
The woman was found by a neighbour on the floor of her home, where paramedics suspect she had been for several days.
Do you know where you are at the moment? So the lady in here, 76-year-old female, she's been found at home, really lying on the ground with like a magazine stuck to her legs. Her legs are really full of sores. We can't feel the pulses in one of the leg because it's so necrotic looking. There's actually some maggots crawling around her leg, and she's now incredibly septic. Her blood pressure is really low. She's really quite sick.
My name's Iromi, this is Darren. You're at St Vincent's Hospital. Can you try to sit up for me? Is that sore? Is that painful? She's not really following it.
No, it's not following instructions. She got probably something called a hypoactive delirium as well, which is probably exacerbated with her infection. So there's confusion, acute confusion.
The patient's confusion is a serious symptom of sepsis, a bacterial infection that, if not treated, can lead to organ failure and death.
We're obviously incredibly concerned about the legs. One of them is no pulse, so she might end up having to go for an operation, and she might end up losing the leg. So it's pretty serious. I'll get the antibiotics started.
The patient is given IV antibiotics and fluids as the team races against the clock to try to save her legs and prevent her suffering septic shock, a significant drop in blood pressure that can lead to heart failure.
So we're just trying to give her a fluid resuscitation, but she's non-compliant with keeping her arm, so that's why I'm kind of holding her arm to get these fluids in to try and improve that blood pressure. 67 systolic's incredibly low. Someone who's mid-70s, female, reasonable weight, you'd expect them about, 130, 140, not that. If she continues with her blood pressure like that, she'll only so long she can handle, and then she'll crash.
the 10th floor at St Vincent's private hospital, neurologist Dr. Tish and neurosurgeon Dr. Yonka are checking in on Parkinson's patient Anne following her deep brain stimulation surgery.
There you go. Come see it. Just stimulating sort of mid-array, contacts 1 and 9.
With the electrodes now implanted in Anne's brain, the amount of current passing through them can be fine-tuned remotely.
Rigidity at 0.3. So I think it's clearly providing excellent benefit. How do you feel your Parkinson's is at the moment?
Well, it doesn't feel as though it's there, actually.
That's good.
Yeah, it is, isn't it?
Good stuff. Excellent.
The recovery is rapid. It's actually amazing how quickly people can recover from this particular procedure, given that it's brain surgery.
After 7 days in hospital, it's finally time for Anne to go home to her husband, Henley.
You did very well. No drains, just walking as what physio has recommended. Just take it easy for the first 2 weeks. 2 weeks. Naomi, she might ring you, like, just to check on you when you settle here.
The reward of being a nurse for me is to make a difference. I hope Anne has a better quality of life and can go back to doing the things she loves doing.
Having my hair shaved off was probably the most confronting thing of all. Although when I look back on it, it doesn't really matter now. I don't really care. I quite like the feel of it. I run my hands over it all the time and it's not so bad.
I wish you all the best. Yeah.
Thank you.
All right. Take care.
Okay, see you.
Yeah.
I guess when I look back, I wasn't very well when I first came in here. I certainly feel quite well. I feel I can get up and walk around easily and I don't think I'll get so tired. I feel quite liberated, actually. I feel good. I hope to feel a whole lot better for a whole long time now.
You're in the emergency department at St Vincent's.
In the emergency department, Darren is treating an elderly sepsis patient.
You've got the really bad infection in your leg.
The severe infection has caused confusion and delirium, leaving the woman unresponsive.
Hello.
Yes.
First words you've said so far.
But after administering IV antibiotics, the team finally has a breakthrough.
Where do you live about? Where do you live?
Really? In Australia? Or...
Australia, yeah.
Well, in Darling Point.
Darling Point, that's good, that's right. And do you live alone?
At present, yes.
At present, yes. Okay. It makes us feel better that she's certainly more alert despite that blood pressure. And when I'm feeling her heart rate is strong, so that's reassuring. I'm feeling a lot better that you're talking to me now. Because you weren't talking at all for a good 2 hours. So that means that something that we're doing is making you better.
I've worked with Darren for just over 1.5 years. He really does care.
You can hold my hand if you want. Want to hold my... There we go.
He wants the best for everyone.
Can you move your toes? Move these toes for me. Are they sore?
It's a bit sore.
Yay. No wonder. I remember when I was a student nurse, one of the nursing assistants back home in Scotland, she had said to me, you know, that woman over there? And I looked over and it was like an old woman. And she was like, you treat her like it's your gran. And you remember that throughout your career and you'll do well. And I guess I've always kind of just kept at it.
It says in 1 leg or 2 legs?
2. I know. They managed to contact the neighbour that's been looking after her. She is a lady that lives alone. She suffers from agoraphobia, so doesn't leave the house normally. The neighbour does all the care. She's got sons overseas, but I don't think there's good contact there at all. And it sounds like she's just been left on her own for quite a while.
With her blood pressure still dangerously low and the infection in her legs a serious cause for concern, the decision is made to transfer the patient to the intensive care unit.
It's so lucky that the neighbour found her. She's going to need a lot of nursing care. Yeah, she's going to need a lot of intervention. This would probably be one of the worst dressings I've ever did.
Bit awkward though, huh?
Yeah, it happens everywhere. You know, old people with no family around, no one there for them. It's just not the way it should be, really. But there is so many old people at home with no support. Now that we've got this patient with us, we can really try and get her better. Because we've got her in the hospital system now, we can try and get the services there, you know, try and really support her so it doesn't happen again.
February 2021. It's a big day at St Vincent's. Australia's COVID-19 vaccination rollout has begun, and frontline medical staff will be the first to get their jabs.
The registration process, are we ready to go with that?
Setting up now.
Lovely.
Senior nurses Danielle and Rachel from the disaster management team are in charge of setting up the hospital's staff vaccination program.
We've got the paper consent forms, yes. We'll write the temperature on those. Right, let's go get the vaccine. Very exciting. Hopefully we'll do about 20 to 40 staff, just as a bit of a soft launch while we get our processes in place.
Danielle is Miss COVID St Vincent's, and so between her and Rachel, I'm sure they'll kind of make sure everyone's vaccinated.
Thank you. The vaccinations, they're extraordinarily secure location in the bowels of the hospital, to the point where we had to get the local police to come in and do a site security assessment.
It's Danielle's job to collect the vaccine vials from the pharmacy.
Are we ready? I'm so ready. Oh my gosh. My role is incident response and disaster management. A historic moment. The last 14 months, it's really just been leading the hospital's response to COVID. I think between our clinics and our amazing pathology team, we've done over 500,000 COVID tests. I'm exhausted just talking about it.
And here we've got a vial and 10 labels.
Now we're in COVID vax.
The target today is 40, but Danielle has enough to vaccinate 100 members of staff.
To actually get to this point has required a lot of work from a lot of people. Hello, everybody. I have the vaccine.
Oh, it's here. Oh my gosh.
So in each one, there's one vial and then the 10 labels. It's a big event.
This vaccination is going to save the world. It's our, Obi-Wan, it's our only hope. Help me, Obi-Wan. Help me, AstraZeneca. You're my only hope.
Rach is hilarious. She's my fellow master of disaster. We're complete opposites, but we complement each other. We have worked together for 17 years now. 17 years of marriage.
It is, isn't it? And we always say, you know, because we are very, very different. She's Slap It Up Sally, I'm Protocol Patty. I am very by the book and doing it properly. Just checking with me.
Yeah, I'm shorter than you. I can't...
Oh, sorry, love.
First dose.
Is our first patient here?
Yeah, they're there.
Oh, great, good. There you go. Ah, there it goes.
We gave our first vaccination and, you know, it's a really special moment for the service, but also personally for our team. So here's your vaccination. It's so important for us to get the vaccination rollout really happening. Can I take a photo, Stephen? The sooner we can get everybody vaccinated across the community, not just across the health service, the sooner, the things that we used to take for granted can start up again.
We haven't socialised together forever because of COVID.
I started drinking zero alcohol wine.
What's the point? It's like going to Macca's and having a salad.
It's been a hugely successful day for the team, who've exceeded their target of vaccinating 40 staff.
I think we did 96 in total. Yes, we will definitely be having a drink to celebrate our achievements today.
No, thank you. We'll see you tomorrow. I just need a gentle downward slope.
I'll push you in the pond.
Please. Can you?
You were joking. You're about the stairs. I can't believe it was like seamless.
Considering we thought maybe we'd do 20 to 50 vaccinations and we did nearly 100, I'm pretty happy.
Cheers.
Cheers, love.
Oh, we did it.
Patients aren't numbers. We certainly treat everyone as if it was our loved ones lying in that bed space.
It's awesome at the end of the day. The work that we've all done has helped and saved a life.
In surgeries where the brain is involved, I think we make a huge difference, and it's nice to feel like we have made a difference to someone's life. That's pretty huge.
Some aspects of nursing, you're seeing a lot of death. Watching that moment of when baby's born is beautiful. Just to see new life coming through.